What's a stretching program for? What's the purpose? Warm up. Okay, sure. That's a great one. You just want to get loosened up and warmed up in order to get ready to do more physical work. Especially important for truck drivers, right? Because one of the main problems there is static positioning, or being in one position for a long period of time and then having to leap into physical work. Okay, what else? What else can stretching be for? That's how it's traditionally used in the workplace, is simply as a warmer-upper routine.
Make you aware of physical hazards, physical challenges, and make you aware of your body before you get into doing the physical.
Sure, and if you know where you're tight, you're going to be a lot more careful. If you notice your back's tight on a given day, it's going to make you a lot more aware if you have to go, lift chains or pick up a tarp or something like that. So that certainly can help. Any of you ever stretched for pain or discomfort? Okay. If you've been in physical therapy before for any sort of problem, you know that a lot of times they'll use combinations of stretching and strengthening exercises with which you can relieve certain symptoms. And that's kind of the approach I take with stretching. And I think it gets people interested in stretching if they think that they can take care of some of the aches and pains that they tend to have in relation to the work that they do on a daily basis. It oftentimes creates a little bit more motivation to learn how to do that. Pain is a great motivator, I find, and people are much more willing to learn when they have something that's either bothering them on a continuous basis or it's interfering with them actually performing their job duties. Okay. So what I want to start with, let's see, I want to make sure that I don't talk too long here, so about halfway through we want to start actually doing the stretches. So Dale, I'm going to put you in charge of cutting me off if I get too long-winded here, and make sure that we get to the activity, because that's the main thing I want to share with you, is we're going to go through the stretching routine that we're going to work with today, and have all of you try it and have me give you some feedback. In fact, let me hand this stuff out now. There should be more than enough. The stretching routine on top is actually the thing we're going to look at last, but you'll figure out what we're doing when I get to the overheads. The routine you're looking at is actually one that I developed for Sherman Brothers, minus their logo, it's a training that I put together specifically so that the truck drivers have something in their hand in the cab that they could look at and refer to, and hopefully start using some of those on an as-needed basis. All right. With a stretching program, what are some of the things that make it successful? If somebody's going to set up a stretching program on the job, what are some of the things that make that successful? Well, sure, but I mean, how do you actually get them to use it in the first place? Teach it. Okay, so some kind of training where they actually get some, handing them a sheet of paper is one way to do a stretching program. All right, probably the lowest rate of success as far as that goes. All right, doing a training of some sort where they're actually being taught by somebody who knows how to stretch properly is the better way to do that, where they're actually getting some information, having a chance to try it with some supervision, with some instruction. Okay, another thing that has to do with successful stretching programs, that generally if the people get together as a group in the morning, all right, and stretch together, that's one of the key factors. All right, not going to happen in truck driving, is it? Okay. Let's see, what else?
I think time is a big issue. Typically when you say stretching, sometimes folks think they need to do 20 minutes of stretching.
20 minutes of stretching. So the stretches need to be specific a lot of times, which is a lot of what I do also, is trying to key the stretches towards the areas where people are actually having problems in relation to the work that they do. Okay? So, as we think about that, some of the challenges about having truck drivers stretch, it doesn't fit in well with the traditional model of what's worked well for industry in general. So they're really going to be on an individual basis of deciding whether they do the stretches or not, which stretches they do, and how they stretch. So I think education or training is really the key. All right. Let's go ahead and jump in with talking about muscles and how they function, and then we'll talk a little bit about how they tend to dysfunction in relation to the challenges of driving. Okay, so biceps is a good, can you all see that from way back there? Can you all read that? No. Can you really? No, okay. I'll read it for you. All right, but that's a good example of a typical muscle, is the biceps muscle there, where you've got sort of a thicker muscle in the middle. It tapers down on either end to where the outer covering of the muscle becomes the tendon. The tendon connects to the bone, right? And then the tendon on the forearm, and then the tendon connects up on the shoulder. So that when the muscle contracts or shortens, that creates a leverage or a force on the bone that allows you to move your arm. And then when you relax that muscle or tighten the muscle in the back, then it drops back down. All right, so muscle contraction, muscle's contractile, it shortens, it lengthens. That's how we move our bodies and do the things that we do throughout the day, whether it's walking or driving or wiggling your ears or whatever it might be. It's all basically muscle contraction in one form or another. If we break that down into its components, all right, then we take that little segment out of the muscle there, take it to there, and as you break it down into smaller and smaller components, you can see that it's a series of sort of smaller and smaller bundles of cables, all right, until eventually you get down to the microscopic level where we're dealing with molecules, where ultimately what you get is these actin and myosin filaments put together in what are called sarcomeres, or functional muscle units, all right, and they sort of orient themselves like this, where there's an overlap, so that when your brain says reach down and pick up that cup of coffee, all right, those fibers slide over the top of each other so that a muscle segment that was this long becomes this long. All right, that's how your muscles shorten. There's millions and millions of these segments shortening, all right, creates a shortening of the muscle and a movement of the body. All right, the more force that's needed to do a particular movement, the more muscle segments are recruited to generate that force. Okay, so not many for a cup of coffee. If you're lifting a 40-pound dumbbell for a bicep curl, you're obviously going to need to recruit most or all of those segments. All right. So what happens to the muscles of drivers? One of the things that I like to think about as I look at somebody in the work that they do is note how their body tends to shape in terms of their soft tissue to their regular position or the repetitive movements that they do. All right. If we're talking about a driver, what's that going to look like? Okay, seated position most of the time, right? Vast majority of the time they're going to be in a seated position, so I'm going to look at hamstrings probably being tight. I'm going to look at hip flexors probably being tight. All right, those are two key factors because both have a large impact on how the lower back functions. Right? So obviously there's going to be some emphasis on looking at hamstrings. A lot of times drivers will tend to have their hands on the wheel or on the stick shift, which means their arms are out in front of them. Generally you're going to see more tightness in the chest, front of the shoulders. They tend to pull the shoulders forward. All right, also with drivers, because they're looking out away from them, unless they're really conscious about sitting up and using the headrest, the head will also tend to be out in front, which tends to put more pressure on the front of the neck muscles. Those will shorten and create sort of an imbalance between front and back. All right, so when I'm looking at a job and I'm looking at developing a stretching program, what I'm looking for is where the imbalance is being created and how can you use stretches to eliminate that imbalance or minimize that imbalance. All right, and a lot of times it's as simple as looking at where their body's getting pulled or positioned and doing things that reverse that. Okay, and you'll see what I mean when we actually get to the stretching routine. All right, so if you're looking at somebody who sits all day, those hip flexors aren't just going to get tight over time if they're sitting and they're not stretching them out, especially if they're getting to a certain age. They're actually going to shorten so that those muscles in the hip flexors, those muscles in the hamstrings are not just going to be short until they get up and move around. They're going to tend to stay short. Right? A shortened muscle creates increased pressure on the tendons. Increased pressure on the tendons will create increased pressure on joints. All right? When you get to the point where muscles are imbalanced enough to where you're getting pressure on the joints, that's where you're increasing your likelihood of soft tissue injury, all right? Or MSD injury, a term I'm sure you're all familiar with, musculoskeletal disorders or musculoskeletal injury. Okay? Does that make sense? All right. Now with truck driving, it's more of a problem of static positioning and then leaping into activity, but repetitive type movements will also do the same kind of thing. All right, for those of you that are working in other areas where there's more of a manufacturing approach, you see the same sorts of things. The muscles that are used on a regular basis through a particular range of motion will gradually shorten to either in reaction to that or to accommodate that. All right, so when I'm looking at a muscle and trying to stretch, I'm looking at muscles that are actually shortened. They're not just tight. I see that as a key difference. Okay, and when we talk about stretching technique, we're going to talk about how do you get those muscles not just to stretch, but to lengthen. Okay, you lengthen the muscle, you decrease the pressure on the tendons, decreasing chance of tendinitis, you decrease pressure on the joints, decreasing chance of joint injury. We'll talk about that in a little bit more detail. Any questions on muscle function and muscle dysfunction. So far, so good. We can come back to this if we need to. Let's talk about some risk factors. So from what I gather from Dale, is one of the things that we're dealing with mainly with flatbed drivers is back injuries. Is that correct? We're seeing more lower back injuries than anything else?
Back and shoulder.
Back and shoulder.
And then
And some knee. Okay. All right, so if we look at risk factors for musculoskeletal disorders or soft tissue injuries, and by MSDs, I'm including lots of different things. The classic sprain strain injuries, which I'm sure you're all familiar with. We're talking about disc injuries fall into that category. We're talking about rotator cuff problems, which I'm sure are most of the shoulder problems that you're seeing. Cartilage, ligament problems in the knees. The compressive problems, carpal tunnel at the wrist. All right, compressive problems at the elbow, compressive problems at the shoulder, where changes in alignment or muscle tension are creating pressure on nerves or blood vessels. All right, so those all kind of fall into that category. The itises, tendinitis, bursitis, tenosynovitis, right, all kind of fall into that MSD category. All right, I'm the stretching guy, so of course poor flexibility is going to be at the top of my MSD injury risk factors list, right? And that should be in your stack of handouts there, as I made copies of all my overheads so you can follow along if you like. All right, so poor flexibility, obviously, is going to lead most often to sprain strain type injuries, right? You got somebody with a tight back, they've been sitting for 3 or 4 hours, they go to lift a tarp, guess what? The muscles aren't ready to work, the muscles are going to give. All right, my definition of an injury is when the load placed upon the body exceeds its capacity to absorb it. All right, so you can either do two things to prevent that from happening. If you know you're kind of getting to the edge of what your body can handle, you can either decrease the workload, all right, make a lighter tarp, put it on with a forklift, something like that, or you can increase the capacity of the body to handle the workload. If it's something that absolutely is going to have to be done no matter what, then you've got to find a meeting point somewhere between those two. All right. Poor flexibility often leads to poor body mechanics. All right. And I'm sure this is a factor in some of the back injuries and shoulder injuries that you're seeing. Is poor alignment will often increase the chance of an injury. All right. Poor joint alignment makes that joint susceptible to injury. It makes it weaker. All right. Good joint, a joint that's aligned well with good balance muscles around it, it's pretty difficult to injure it. All right, with the normal workload. Right. One of the things I see also is that poor flexibility often leads to poor body mechanics. We were talking about hamstring flexibility. I'll see this a lot in body mechanics trainings where, a lot of what I'll focus on is being able to maintain a neutral position while bending the knees. That's sort of a basic skill, but a lot of people can't do it. And a lot of times it's primarily because the butt muscles, the hamstrings, lower back muscles are so tight that as soon as they start to bend their knees, their butt will tuck under. Right? And even if you're bending your knees, it's going to take some of the pressure off your back, but a lift from here is still probably going to be 60, 70% back muscle and ligament lift. Right? That's where the pressure is going to go, as opposed to being able to keep the rear end out, drop it behind, and maintain a neutral spine position. Okay? And you'd be surprised how many people simply physically cannot do that because of hamstring, calf, butt, lower back tightness. All right? It's a mechanical restriction that they just have to work on until they can get past that point, and then you maintain good alignment in the back, which kind of leads to everything else. That's a whole nother training. Okay? Age. Is this a factor for any of your drivers? Okay? At what age do people start losing their natural flexibility? Anybody know? There's kind of a range, but when? About 3? There are special circumstances, yeah. Generally people notice that you don't have to do a whole lot in your 20s to maintain flexibility. Once you get into your 30s to mid-30s, people are usually noticing that if they're not doing something on a regular basis to maintain flexibility, meaning stretching, lifting weights, some sort of cardiovascular exercise, that they're generally going to lose flexibility over time. All right, it's just sort of a fact of aging. One of the other things that happens is you'll generally lose some ability to heal. All right, so restorative abilities of the muscles and the soft tissue diminish as you get older, so that things that sprains and strains that used to heal up in a couple of days, maybe they take a week or a week and a half now or longer. All right, I'm sure some of you have some personal experience with that as well. Let's see, I'll be turning 40 next month, so I now know that all my stuff that was just theory 5 years ago, now I know from personal experience that yes, it is actually true. Okay, highly repetitive work Heavy and repetitive work combined are two key factors. More important with trucking is that static position that I was talking about, right, where you're locked in one position for long periods of time without moving around. In addition to that, you add vibration, all right, and that creates extra opportunity for the body to tighten up, right, and for muscles to shorten. Okay, this probably doesn't apply either, but not enough rest or sleep. Okay? Why is that an issue in terms of increased risk of soft tissue injury, either in the shoulder or the back? What's your body doing when you sleep? Resting, repairing, regenerating, remaking muscle energy storage. So if you're not getting that, then the body tends to be sort of constantly running on empty. Muscles don't function as well, increased likelihood of sprain, strain type problems. Poor cardiovascular conditioning, again, kind of goes hand in hand with the lifestyle, right? I'm sure some of the drivers probably get out and walk on a regular basis when they get a chance, but mostly it's in the seat is where they're what they need to do is find a driver's seat that has a stationary bike attached to it, and that would solve a lot of problems, right? Yeah, you don't know, might be a little dangerous. That's right. I think you're onto something here. Ergonomic workstation design, boy, I see most of the trucks have pretty good seats and pretty good design these days. Most of those seats are pretty adjustable. Is that? I mean, I'm sure people have kind of made that a priority as the years have gone by, and good air seats and good cushioning and good vibration absorption. So that's not as much of an issue with drivers as I think maybe it was in the past. But always something that you can look at, and other tasks involved in what they do certainly can benefit from ergonomic attention. Tobacco or caffeine use. What are both these substances besides heavily used by drivers? Stimulants, right? What do stimulants do to muscles? They make them tighten, all right? They make them tense up. They also tend to dehydrate, okay, which is another factor. You're much more likely to have soft tissue type injuries if you're dehydrated than if you're fully hydrated, all right? Poor diet, again, probably not a factor here, but we bring it up anyway just in case that might be a factor, all right? Any questions on those? Benefits of stretching. Okay, so first 4 or 5 kind of go hand in hand. Reduce pain, stiffness, achiness in muscles and joints. All right? As I said before, that's what I really like people to think of, is it's not just warming up. Drivers in particular may be much more open to the idea of using their stretches to deal with some of the aches and pains that come with the job. I know they have them. Most of them probably rely on Advil. A lot of them would probably like to have some other skills that would help them deal with that, right? And this is something that you can certainly do that way. Improved circulation kind of goes hand in hand with reduced pain. One of the problems with muscles that are tightening and shortening is they tend to squeeze off their own blood supply, so you see decreased circulation to the muscle tissue. Again, makes it less healthy, less functional, more prone to injury. Okay?